Hi, everyone. I'm Nicole. I'm Good Dogs Community Lead, and I just want to welcome everyone to our presentation today, which is a primer on pregnancy care in canines with our guest, Dr. Frances Smith, who has been here for many webinars already this year. We absolutely love having her, so we are so excited to have her back. Today, Dr. Smith is going to discuss what you need to know about guiding your female through a safe pregnancy and delivery of healthy puppies through a review of the basics of pregnancy care. So I imagine this will be helpful for any type of breeder, no matter how long you've been a breeder. So really excited to share more about that today. And we're so excited to partner with Purina, as always, to bring you another one of these Good Breeder webinars. We are just so grateful that we get to bring these opportunities to our community members and really help every single person at Good Dog really better their programs and learn really critical information, and that we can make it accessible for all of you, no matter where you're joining us from, wherever it is in the country. So that's why we love virtual events just like this. As always, we got a ton of previously submitted questions for this presentation. I think we might have hit a record for this one, so it seems like everyone here has a ton of questions for Dr. Smith. We're going to prioritize those previously submitted ones, and then we'll do our best to get to the ones that come in through the chat as well. And before I share a little bit more about Dr. Smith, I just want to share a little more about Good Dog in case anyone here is unfamiliar with us and what we do. So Good Dog is on a mission to build a better world for our dogs and the people who love them by advocating for responsible dog breeders like yourselves, educating the public, and promoting canine health through events just like this. We're an online community that is created just for dog breeders, and we're also completely free for dog breeders as well. We use the power of technology to help our good breeders level up their breeding programs by giving them tools to connect with really serious, committed applicants from across the country, a secure payment system to protect you from scams, and software to post your available litters and find forever homes for your puppies. We also have additional breeder educational resources, more webinars just like this, tons of articles, discounts. So if any of that sounds exciting to you, hopefully it does, and you're not yet a member of our community, we'd absolutely love to have you join us by applying at gooddog.com/join, which we've just dropped in the chat as well. And I want to quickly share a little bit more about Dr. Smith before I pass things over to her for this presentation. Dr. Smith became a diplomat of the College of Theriogenology, always a tough word for me to say, in 1986. Since that time, she has been in private practice as a small animal practitioner, specializing in canine reproduction. Dr. Smith is one of very few board-certified theriogenologists in private practice. Her expertise in genetic counseling, chilled and frozen semen, and reproductive infertility of male and female canine is known throughout the United States. Dr. Smith frequently speaks to breed groups, veterinary associations, and students, and the general public. Dr. Smith retired from full-time practice in March of 2023, but maintains licenses in Minnesota, Mississippi, and Colorado. Dr. Smith grew up in a military family that bred German Shepherd dogs. I'm not sure if we have any German Shepherd dog breeders here. Her commitment to veterinary medicine began at 7 years of age and was confirmed in her high school yearbook, which stated her goal was the patter of 40 little feet, not human. So we are so excited to have you back here, Dr. Smith. I will pass things over to you to get the presentation started.
Thank you very much, Nicole. It's great to be back with you. Well, I'm excited to be talking to the Good Dog community about pregnancy in the canine. And I have lots of information for you. So there may be so much, particularly with your questions, that we may not get through it all, but there's always another day. So who I am, Frances Smith. I'm a veterinarian with a specialty in theriogenology. That's the reproduction specialty. Theriogenology is actually a combination of human, OBGYN, and urology. I'm also the president of the OFA, the Canine Health Information System, which is the world's largest animal health database. I'm the president of the Labrador Retriever Club Incorporated and the health chairperson. And I'm a dog breeder of Labrador Retrievers under the registered name Danik. As Nicole mentioned, I grew up with German Shepherd dogs. My first show dog was a Pomeranian, and I've come full circle. While I breed Labrador Retrievers, I recently did return to the German Shepherd world and bought a German Shepherd puppy. So when does pregnancy care begin? So pregnancy care for each of you starts with your selection of a potential breeding female. And I hope when you're thinking about breeding dogs, you think of all these issues, because it's not as simple as buying an XX canine. It's influenced by genetics, environment, nutrition, socialization, and healthcare. So that means to make progress in dogs, you want to start with the very, very best female that you can. There are lots of stud dogs available, but if you start with suboptimal females, you're not going to make good progress. So to select a potential breeding female, things to consider: ask the person you're buying that puppy from how many puppies were in the litter. If you ever breed like a Labrador, you don't particularly want a puppy that is from a litter of 4. Find out what the average litter size is for that breed. It happens to be 7 in the Labrador. And buy a puppy from a litter with at least the average number of puppies. Consider the mothering ability of her dam. While there is no genetic test for mothering, trust me, it's strongly heritable. Good mothers tend to produce daughters that are good mothers, and the vice versa is true. And also consider the milk production of her dam. I'm sure that you all have experienced females where the puppies are fat and robust, and other moms with the same number of puppies where the puppies are always scrawny and little. That has a lot to do with her milk production. Also, because you intend to have more than one litter, or most of you do, consider the interestrus interval of the puppy's mother. Normal interestrus interval is 4 to 7 months. So if you select a female puppy from a mother who cycles every 9 or 10 months, you can predict that she will do the same. Consider the gestation length of the mother's pregnancy. There are some breeds that reliably whelp what we consider early, and then they have weak puppies. Consider any medical or interventional support needed to keep that pregnancy. If the mother of this puppy needed hormones to keep her progesterone high to maintain her pregnancy, reconsider that, because that also is heritable. And consider the age of the mom. Reproductive success depends on a lot of different factors, but peak reproduction in the female canine is between 2 and 4 years of age. A young female should not be bred until she is mature enough to complete appropriate health testing for her breed. So in the case of a dog like a German Shepherd or a Labrador or a Vizsla or a Berner, she should be 24 months of age or older, so she's old enough to have had her hips and elbows x-rayed. Fortunately for all of us, eyes can be checked the first time at a very young age. Toy and smaller breeds should not be bred at the first heat cycle. I know that's tempting, but some of these little toy breeds will come in heat at 6 to 7 months or maybe even earlier, and that is just too young. If they are bred at that age, they're commonly very poor mothers, and they don't do a great job whelping either. Female canines, on the other hand, do not experience menopause, so they do cycle until they die. As they age, though, the cycles are weaker. By that, I mean there's not as much vulvar swelling, there's not as much blood, so it may be hard to catch that they are, quote, in heat. It also makes them more at risk for a disease of the uterus that we call pyometra, which literally means pus in the uterus, and that occurs as a hormonal event in female canines. At age 6 and above, there are fewer eggs ovulated, higher loss of embryos and fetuses, and a higher incidence of dystocia. Interestingly, within the uterus itself, when that female puppy is being grown from that original egg and sperm, during that developmental stage at birth, a female puppy has all of the eggs in her ovaries that she will ever have. So with each subsequent cycle, whether she's bred or not, there is egg loss. That's a normal normal follicular pattern, and so the older they are, the less eggs they do have to ovulate. Socialization, also important for a good breeding dog. Good mothering ability requires that a puppy is nurtured by a loving mother. Normal reproductive behavior does require adequate time spent with their litter mates and with their mother. And puppies need to be with their litter mates to develop good reproductive behavior. This is just a litter of puppies born by C-section at my clinic, and you can see we have them in a nice warm environment. They're doing very, very well. This was a dystocia due to the fact that two puppies were stuck literally at the junction of the two horns at the body of the uterus. Let's talk a little bit about singleton. A one puppy litter for me is that I would rather in my own females have no puppies than one puppy. Singleton puppies do not develop the social skills that you need to support mothering and nurturing skills. You can make up for that if you have other litters or other mothers by allowing that singleton to interact with other puppies of around the same age so that they learn how to bite, growl, mount, all those important things. Years ago, I loaned a Labrador puppy to one of my English Cocker friends. I had a nice big Labrador litter, and she had a singleton. So we loaned her two puppies, and it was a wonderful situation. Only change that it made was there was an English Cocker puppy who always wanted to be in the water, but they had a great time, and that puppy of the clients did end up to be a show champion and a wonderful mother in her own right. So the potential breeding female needs optimal nutrition, and that nutrition starts while her own mother is pregnant. So I want to remind all of you that, and we're going to talk more about nutrition here, that most dog foods are labeled for maintenance. And maintenance means a dog that has no additional stresses on its system. So this is a dog that is laying on the couch, walks around the block, has no need to expend extra energy or extra nutrients. For a breeding female, they need to have extra stuff. So that potential breeding female needs optimal nutrition while she's maturing, both as a baby puppy, primarily also during prepubertal growth, between her heats and during her heat and during her all pregnancy. So the potential breeding female needs an all life stages food or a puppy food that is consistent with the potential adult weight of that female. So if you look at the bag of your dog food, and I cannot tell you how often I am reminded of this, read the label. I was just at the Houston dog shows and had an opportunity to talk to lots of wonderful people there, most of whom had never looked at the back of the bag of dog food. On the back of dog food, there will be a label that will say what that dog food is intended to supply and to whom. So if it's for maintenance, that's again for that dog or female bitch who is not going to do anything other than be a family dog. AAFCO, which is the American Association of Feed Control Authorities, does not directly test, regulate, approve, or certify food, but it establishes guidelines for ingredient definitions, product lab and feeding trials, and laboratory analysis of nutrients that go into pet food. Third-party testing is performed for analysis of these foods. I would also like to tell you that the great majority of dog foods in the United States are never fed to a dog. And if you were to ask a board says that food adequacy is established by feeding trials. Foods that are marketed for all life stages must meet more stringent requirements of growth and reproduction. However, this is not an AAFCO designation. Nutritional adequacy standards established must be met or exceeded in order for a dog food to be marketed as complete and balanced for a certain life stage. So for growth and reproduction, AAFCO requires that there is at least 22% protein, and that's broken down into specific amino acids, at least 8.5%, and the following minerals: calcium, phosphorus, potassium, sodium chloride, magnesium, iron, copper, manganese, zinc, iodine, and selenium. Vitamins A, D, and E, which are fat soluble, that's important. Thiamine, riboflavin, pantothenic acid, niacin, pyridoxine, folic acid, B12, and choline are water-soluble vitamins. However, the real recommendation for optimal performance is you want 28% protein, at a bare minimum 26% protein, and around 18% fat. So even AAFCO standards for growth and reproduction are lower than optimal, but they're adequate. Vaccination needs, and I think this is important for you to understand. Canines have a very complicated placenta. The placenta obviously is the method by which the puppy is attached to the uterine lining, and it allows the mama to take care of all of the elimination products and provide nutrients to that growing puppy. So canines have what is called an endothelial chorial placenta. It is zonary, which means it's band-like around the puppy attaching to the wall, and chorioallantoid, which is the type of placenta found in many, many canines, very, very different from the human placenta. What this means is this placenta prevents antibodies, which are the protective organisms that the mom has, from being given to the puppy prior to birth. A human baby, if the mom has been vaccinated, gets many, many of those antibodies through the placenta while it is still in utero. A puppy does not. In fact, this type of placenta nearly prevents any type of antibody transfer through the placenta. So that means puppies rely on nursing and getting maternal antibodies that are present in the colostrum. The antibodies in the colostrum disappear in about 48 hours. This is a cute little baby Labrador puppy. He was about 3 weeks old. So a puppy must consume colostral antibodies within 48 hours of birth and prior to getting any milk or formula to receive the protection. So let's say you have a puppy that's weak and you decide to tube feed it because it's not nursing well at 6 hours. That means that puppy will not have absorbed the antibodies, because once milk or any kind of formula hits the gut, that gut barrier closes down and it cannot absorb the colostrum. For many infectious diseases of canines, a puppy will receive approximately 95% of the DAM's antibodies and colostrum. Now, why is that important? There are known what we call decay profiles of colostral maternal antibodies. So for instance, canine parvovirus, we know that if a puppy is born, nurses its mom, and gets a high level of colostral antibodies, we can actually calculate, if you know what the mother's antibodies are, and every 9 days, those antibodies will fall by 1/2. This means you can calculate exactly when a puppy will be able to respond to vaccination. So again, an important point for you to know here: for every puppy there is a period of time when vaccinations do not protect it, and its mother's colostral antibodies are gone. And we'll cover those issues in a little bit, but I want you to know every puppy will have a period of time when it is very susceptible to infectious disease. A complete vaccine series of the mother with seroconversion by the recipient is necessary for the breeding female to provide protection against infectious agents in colostrum. So if in fact the mother is not well protected, the puppies will get nothing. And if she has minimal protection, likewise, the puppies will become susceptible to disease early in life. And we talked about this with the known degradation of antibiotics. You can measure and predict when a litter is susceptible to infection. Those decay curves are well known both for canine distemper and for canine parvovirus. A female then should have vaccinations up to date prior to breeding to maximize the antibodies she can give her puppy. Excuse me. Modified live virus vaccines should not be given to pregnant females, but can be given during proestrus. So say, for instance, you walked out and said, oh my goodness, Susie is in heat a month early and she was really due for vaccines next month. Can you vaccinate her then? Yes, you still can, because there is not an egg ovulated, there is not an embryo or a fetus of any type going on at that particular time. So that is a good time to hurry up and get those boosters done. My recommendations include what are called core vaccines as defined by the American Veterinary Medical Association. My recommendations for vaccines are as follows. Distemper adenovirus 2, which we use to protect against hepatitis, parainfluenza, leptospirosis, the four-way leptoparvovirus, and vaccination for kennel cough complex and rabies as required by local law. In many areas, you're also going to want to vaccinate against Lyme and coronavirus. I personally rarely give coronavirus vaccine, not because it's not safe, but because it does not provide a high level of protection. This next section is profoundly important. Testing for Brucella canis should be done 30 days prior to a cycle. Brucellosis is the #1 sexually transmitted disease in canines, and most veterinary clinics will draw the blood, or you draw the blood. They'll have to send a sample to a reference lab for testing, so results can take 4 to 10 days. There used to be an in-house test, but that is variably available now. Brucella organisms are present in the ejaculate, in the urine, in the saliva, bloodstream, and in other fluids. I get people who say to me, I don't need to check my female or my male for brucellosis because he's never been bred. All they have to do is be at an event and lick the urine or the spot where urine has just been from an infected dog, and they can become infected with brucellosis. The first case of brucellosis I actually saw was while I was still on faculty at the University of Minnesota, and it was in a pit bull that had been in a dog fight, and she was infected bloodborne from the fighting. Just so you all are aware, artificial insemination, chilled semen, and or frozen semen do not prevent brucellosis. Brucella can survive during the freezing process. So if you are getting frozen semen from a dog, be sure you know that he was Brucella negative at the time of collection. There is a lag time of 30 or more days from the time an animal is exposed to brucellosis before any of our existing testing methods will be able to tell you the dog has brucella. In a kennel situation, newly acquired animals should be tested immediately when you get them and isolated for 30 days and then retested. Unfortunately, or fortunately for the dog, but not fortunate for the person who buys a dog with brucella, it doesn't make the dog sick. They don't vomit, have diarrhea, they don't appear sore, etc. It can cause infertility, abortion, premature birth, male infertility, and in some of the worst cases, it can have what is called hematogenous spread, and it can end up in the spinal column, causing profound spine pain. Brucella is a zoonotic disease, meaning people can get it. You do not want to mess around with brucellosis. In a mill, think about a mill when you vaccinate your puppies, that's not very many. More than 1 billion brucella organisms can be present in 1 ml of that much fluid. So it is a big deal, and it's an important disease to be careful. In most states, brucella must be reported to the Department of Health. Sometimes it's the Board of Animal Health. Sometimes it's the Human Health Department, since it is zoonotic. Zoonotic means people get it, as do other species. Brucellosis is not curable. Recommended treatment for affected dogs is euthanasia, as it is very contagious. And I will tell you that this disease has wiped out kennels all over the United States. Currently in the state of Minnesota, you may not bring a dog into the state that is over 6 months old unless it has a brucella test and it is negative. Parasite control, also an important area to discuss. The potential mother should be tested for heartworm disease, and heartworm preventative should continue throughout pregnancy and lactation. And please be aware, I know a lot of you do this, you use the large animal ivermectin for swine, sheep, and cattle, and you use it orally at very small doses to prevent heartworm. That is not recommended. And the reason that it is not, we are starting to see resistance to ivermectin, but more importantly, the label states on many of the bottles, depending upon which producer produces the product, it says this product is not to be used in dogs as fatalities can occur. Because of its concentration, it is very easy to overdose them, and the vehicle in which the ivermectin is suspended or dissolved is not good for dogs. Read all labels carefully. And here I want to talk to you about topicals, whether it's flea and tick, anything you're going to put on or in your dog, whether it's eye, ear, or skin. Most of those products are neither approved or tested for use in breeding animals. So most of the time you will use those at your own risk. If they're appropriately labeled and you have a problem, it's on you. I can tell you that a friend of mine who had never had cleft palates in her puppies had a female with a terrible ear infection, and she used a very, very popular, excellent ear medication to take care of the infection, which contained a potent steroid. And she ended up with a litter of 9 puppies, 4 of whom had cleft palates. And corticosteroids, particularly some, are known to cause or contribute to cleft palates. Again, many products containing corticosteroids should not be used in pregnant dogs unless the benefit outweighs the risk of the product. Just an aside, when it comes to any medication, every medication has some degree of risk with it. Everything we do in life has some risk with it. So when you're using a product and you're using it against what it is recommended for, you are using it at your own risk. And you always only want to use products that you need. This is one of my females after a litter of puppies. This particular female did have a C-section, and she still has her IV catheter in, but as you can see, she's doing great. Supplements of any kind are unnecessary and may be harmful if you're feeding quality all life stages dog food. Including in this list are herbs, vitamins, hormones, tranquilizers, and other supplements. A lot of people think herbal supplements are not drugs. They are drugs. All of our original drug formulary came from using plants and preparing them in some way so that you could quantify and use them to medicate for particular conditions. So I know people use rosemary, I know people use garlic. The list is almost endless. Don't do that. If you have a finicky eater during pregnancy, you can do cooked meat, canned food. A really simple trick for most dogs is either to use beef or chicken bouillon or broth. Obviously, if you have a dog that has a chicken allergy, you don't want to use chicken broth. But dogs like moist food, and so you want to feed them appropriately and get them to eat well without messing up their diet. Exercise, a hard question for a lot of people. At-home exercise with a stable kennel population is allowable throughout pregnancy, but the female should not be forced or corrected for refusing vigorous exercise. Let her choose. So people say, I'm training my dog in obedience, and we're at the CDX level. Can she still jump? Yes, she can jump if you have the obedience equipment at home, and she's going to be landing on reasonable ground. And if she refuses to jump, you're not going to punish her. When her abdomen is big enough that it's difficult, she will stop jumping. That doesn't mean you need to put the collar on and give her a 5 button when she refuses to jump. Next important point, pregnant females should not attend training classes, dog shows, eye clinics, health tests where she's potentially exposed to viral and bacterial pathogens. And I'm always amazed by what people think is isolation. What I mean is isolation. You live at home and you have 5 dogs and you have one female who is pregnant. She's not going anywhere, but you're taking 2 of your others to training classes. She is exposed just as readily by what those 2 that go as she might be if she were going to those classes herself. So in my breeding life, once a female is bred, she is not in contact with any other dogs in the household that are going anywhere other than riding to the grocery store while I run in to get some milk. Progesterone values. Consider running a progesterone test during the first 5 days of what is observed to be heat. I cannot tell you the number of clients that I have had come in saying, I want to breed my female this time and I just want to know where she is at the cycle. And we look at everything, it looks like she's probably, and she just came in 2 days ago. And we run a progesterone in its 20. Well, you're already too late. The most important number to identify when using progesterone testing is 2.0 nanograms per mil. This number is used as an indicator of the LH peak. It is very difficult to accurately measure LH. I know there are LH test kits, but LH is produced in a pulsatile manner, and it's easy to miss the LH sudden peak. And so we need to use progesterone to manage the LH number instead. LH, it's the hormone necessary for ovulation and excuse me, It's the hormone necessary for ovulation to occur. Theoretically, the female ovulates 2 days after the LH peak. That is accepted across all people in reproduction. But this next line is also very important. Remember, I have yet to meet a female dog that can count or read. So they don't know that ovulation is supposed to occur 2 days post LH peak. Particularly if a female is under stress, being moved around, if you have to time children frozen semen, realize you cannot guarantee that at 2, your female will in fact ovulate in 2 days. It's my little puppy again. Identify the LH peak, a progesterone level of 2.0 nanogram per ml, if at all possible. Because progesterone is stable, you can gather the samples daily, label them. Obviously, you want to separate the serum from the blood and store it frozen, labeled again, and run them as a batch later. So that does allow you, if you're having to ship samples on your own, to kind of batch them. This LH peak is very important to identify when to breed and when the dam is likely to whelp. Peak litter size occurs with a single breeding 2 to 4 days after ovulation. So that's something to keep in mind. If you have fabulous semen quality and you know the female for sure ovulated on a particular day, 1 breeding is adequate. All females should have at least 1 additional progesterone test on the day of or the day after the last day that you bred them to be sure that they did ovulate. It is not uncommon for a bitch to fail to ovulate. There are things that can be done about that, but that's way outside the tone of this particular talk. And progesterone should remain high throughout pregnancy. And in fact, if the progesterone drops below about 2.6, in almost all cases, that litter will be lost. Pregnancy confirmation. There are multiple methods to confirm pregnancy. Palpation was the olden days. We would rely on feeling uterine swelling, and you could feel them at about 25, 26 days, about the size of a good-sized hen's egg. Then it gets bigger, but by 30 days, they're big enough that the uterus feels like a continuous tube and you can't tell. Ultrasonography is the best way. It can be done from day 21 post-breeding to term. And the advantage is it can tell you that is in fact a pregnancy, and it can also tell you that it's live puppies. We also use ultrasound to monitor females who during pregnancy appear big and then get smaller. And you can actually see on ultrasound when the day that the puppies or some of the puppies don't have heartbeats. And then you can see those fetal vesicles shrink. Both the skill of the person doing the ultrasound and the technology of the equipment influence the information that can be gained. I have an ultrasound at home with me. I'm fortunate today, so I can still ultrasound my girls. And it's a very good ultrasound machine. But now we have 3D ultrasound, et cetera, et cetera. At my veterinary clinic, we had a machine that was so good that we could see puppies yawn. And the earliest that we ever saw puppies on ultrasound that we could photograph and give to the client was about day 19 post-breeding. Pregnancy radiographs can be done from day 55 to term and is the most accurate way to know how many puppies are present. This X-ray doesn't hurt the mother, doesn't hurt the puppies, and that will give you the most accurate number. Again, you have to have a decent X-ray machine, and today with digital radiography, that's quite easy to do. There is also a test called relaxin, which is a hormone that prepares the reproductive tract and the pelvis for the birth of the puppies. That goes up after about day 5. And I would tell you it's variably reliable. I have seen it declare that bitches are not pregnant. In fact, one of mine who had 9 puppies the next day, the relaxin test said she was not pregnant. And I've also seen it say that they are when they are not. It's better than nothing, but not great. Litter sizes of 1 to 2 and over 8 puppies are most associated with dystocia, which is difficult birth. Within my clinic, I always recommended a planned C-section for females with only 1 to 2 puppies or large breed females with litter size over 8. Now, in a Yorkie or a Pomeranian, something that is 5 to 10 pounds, 2 puppies probably will be okay. 1 puppy litters are often a disaster. And your highest puppy survival will occur with properly timed and planned C-section. Labor in the canine is influenced by the release of the hormone cortisol from the adrenal glands of the puppies. What makes that happen? When the puppies are crowded, their adrenal glands produce and kick out more cortisol, and that starts the trigger, which starts the labor cascade. Thus, 1 puppy litters may lack the cortisol needed. Pregnancy duration. Pregnancy duration in the canine is 57 to 70 days based on breeding dates. Remember, we talked about how important the LH peak is. Pregnancy duration based on that is 64 to 66 days. And implantation, which is the time when the free-floating embryo that has been in the uterus implants and develops a placenta, is at about day 18. Getting help. Another important area for you to think about. These are puppies, again, post C-section. They're in an incubator. They're being supplemented with oxygen. Be sure that you have secured emergency help for your pregnant female prior to the due date. If you end up at an emergency clinic, many, if not all, of those clinics either have a corporate policy, if they're a corporate practice, a personal or otherwise. Some of them will refuse to take care of your female and do a C-section unless you agree to a spay. I will tell you that legally, you don't have to agree to a spay, but legally also, they also don't have to agree to help you out. So you want to make sure that wherever you're thinking you might need to go, that they are willing and able to help you and willing to do a C-section if necessary. That being said, as a practitioner, I cannot tell you for all of the years that I practiced, which was a very long time, I would have people call me that were not my clients that would say, are you willing to be on call for my pregnancy? And the answer to that was uniformly no. It's a great inconvenience to be available after hours. So if you want your local veterinarians or whoever is going to do it to be available, make sure you've established that relationship prior to the time when you're needed. And that, I believe, completes all my talk. So we are ready for some questions, Nicole, and I see Nate's on as well.
Yes, amazing. We have quite a few questions. I'm going to do my best to answer. I mean, not answer, just ask you as many as possible. That would be crazy. That would be crazy if I were answering these. Okay, one of our questions is about if there's anything you can do to prevent stillbirths from happening.
Well, we can talk about that for like 29 hours. But the biggest primer is paying attention during labor. You should never have more than 2 hours between puppies without getting some help either by phone or in person. You should keep your females in good shape, which includes exercise. Fat, lazy females don't tend to whelp very well. And you should monitor the duration of pregnancy carefully. If a female goes, if she has a temperature drop to 99 degrees or below and doesn't begin labor within 24 hours, she's in trouble and you're likely to start losing puppies. Likewise, anytime you start to have greenish or greenish black vaginal discharge during delivery, you should get some veterinary help as well. But the biggest issues are going to be there during the whelping. Pay attention and don't wait too long between that. I will also tell you, do not fall into this trap of using oxytocin as if it is manna from heaven. Every time you give a dose of oxytocin, you can cause a uterine contraction, which can cause placental detachment. It is not selective. If you have 8 puppies to be born, you've had 3, and you give oxytocin, you likely will start labor again, but you also are going to affect the placental attachment of those other puppies. So don't be so quick with the oxytocin.
Amazing. You actually answered 2 questions in one with that one, because we did have a question.
What do I make with oxytocin?
Yes.
The only time I recommend giving oxytocin is, there's only 1 puppy left, or when you have not seen all the placentas and the female is done to help with placental expulsion.
Amazing. Okay, so now we've seen a bunch of questions also about deworming during pregnancy. So I was curious if you could talk a little bit about, do you recommend deworming? This breeder who asked the question says they've seen some mixed recommendations about it.
All right, so if you are using a product like HeartGuard or one of the others that contain the ingredients in HeartGuard, in essence, you are keeping your females parasite free. If you are using oral ivermectin, that is not happening because, and here I'm talking about the product that I recommended not using, the dose is not correct for internal parasites. So if you were in a laboratory and you were to try to produce what is called specific pathogen-free puppies, which are needed for some research, the females would be wormed with Revolution, which is selamectin, every 2 weeks during pregnancy, and the puppies would be started early. That way you can produce puppies that have no parasites. Some parasites are spread to the puppy in utero and some are spread during lactation. So I definitely do. You can use, again, that would be a really good product to use. You can use Revolution. It is safe during pregnancy. You also certainly can use Ampelban, which is parental pamoate. So yes, they should be wormed during pregnancy. And puppies should start to be wormed starting at 2 weeks of age and every 2 weeks thereafter.
Amazing. Okay, thank you for answering that one, because we had quite a few questions about it. Another breeder is wondering, what are the reasons behind skipping or not heat cycling / breeding?
Okay, so from a physiologic standpoint, the uterus was designed to be used. So by that, I mean, it was designed, if a female cycled, she would be bred and have a litter. And in the wild, that's pretty much what happens, because most wild canids do not cycle more than once a year. Domestic canines, most of them cycle twice a year. So a good compromise, it's a good idea to breed back to back. So have a litter, next heat cycle, breed again, but then skip. Under some circumstances, you might want to breed 3 times in a row, but you really, really have to be taking super care of your mama dog to make sure she's maintaining nutrition and body condition if you're going to do that. So my recommendation is back to back, then skip the third heat. Now, if you have, let's say you have a 5-year-old female and she's having her first litter and she has a C-section, absolutely you want to breed her next heat because you don't have that many cycles left and the uterus is completely healed before that time.
Wonderful. Okay, another question we have here is someone's wondering if there's anything you can do to influence puppy size in vitro. It's an interesting question.
Yes, there is. The biggest thing is really good nutrition, and also realize we talked about the fact that a dog has or a bitch has a zonary placenta. So all of the puppies, and I don't mean a direct competition, but there's a limited amount of space. So the more puppies there are in a litter, the more likelihood is that you will have some little bitty ones because there won't be enough real estate left for some of these placentas to attach in the uterus. So you want really good food that they can, and also make sure that to minimize stress, which can cause changes in hormone levels. And outcross puppies, which means when the parents are totally unrelated, and that whether that's within the same breed or with when you are combining multiple breeds, those puppies tend to be bigger than purebred or line bred puppies.
Amazing. Okay. I think we just have maybe one more, but I could be wrong. So someone is wondering, when a dam is expecting a huge litter, what signs would you look for to indicate she's carrying too many and possibly in danger of rupture?
So that's a really good question, and that's definitely where you want to do your radiograph. So if you do a radiograph, and let's just say the female's going to have 12 or 13 puppies, odds are you won't even be able to count that many because they will all be, a radiograph is a 2-dimensional picture of a 3-dimensional object. So they'll be interposed on one another. But I would say once you get above, again, it's going to depend a bit on the size of a dog, above 10, you're at risk of uterine rupture. And also, that's a good question is, if in fact, getting back to our oxytocin question, if you give oxytocin and you have one of those traffic jams that I talked about where both two puppies are right at the body of the uterus at the same time, the oxytocin itself can cause uterine rupture. Another reason not to be quick to do it. But really big litters, they certainly can have uterine rupture. Another sign to watch for is if the mother is starting to get swelling in her hind legs below her hocks. She's at a huge deficit then, is being able to keep up with those puppies. So there is a risk.
Awesome. Thank you for going over that. I think we have time for one last question. And I know you spent a bit of time talking about singleton litters. So Megan is wondering, for a C-section singleton litter, the dam didn't bond. Can she bond with a normal whelp?
Yes, she can, but you should talk to your veterinarians. And that's not surprising, particularly first-time mom, singleton puppy, she wakes up and this alien's trying to eat her. So think about it from that standpoint. If in fact you will be patient and force her to nurse the puppy and talk to your veterinarian about putting the mom on a medication called metoclopramide. It's used for lots of other things, but it causes release of the hormone prolactin, which promotes mothering behavior. Oftentimes, if you get them on metoclopramide and are patient and continue to let the puppy nurse, they typically will accept the puppies within 48 hours. Now, during that interim period, don't leave that puppy alone with the mom because you could have a major disaster.
Amazing. I think that was our last question. Thank you for going through all of those. I know our community really appreciates it. They had so many for you. Thank you, Dr. Smith, for joining us for another presentation. I know our community just loves hearing from you and learning from you. I do as well. So can't thank you enough for being here again.
Thank you. I've enjoyed it. It's a great group. Thank you all. Have a great day.
Amazing. Thank you all to our community for joining us for another Good Breeder webinar. We are already counting down the days until our next one, so I'll give everyone a sneak preview before I end this webinar. We will be joined again by Dr. Julie Cesari on Thursday, August 1st at 1 p.m. Eastern, and we're going to be talking about a smooth whelping, prepare for disaster, and all will be well. Really great tagline for that event. We're going to get that announced on Facebook by the end of the day today, so everyone can register for our next live event and make sure that's on your calendars. We'll also be sharing more reminders about that, but we're already looking forward to our next presentation. Thank you all again for being here. If you're not yet a member of our community, you can apply to join at gooddog.com/join so you can stay up to date on all of our future webinars and events just like this. So until August 1st, thank you again for being here, and we'll see you then. Bye, everyone. Thank you, Dr. Smith.
Bye. And Dr. Cesare is fantastic. I know her.
She's great. We've had her
Yeah.
on before. Very
Yeah.
excited to have her back.
Good.
Awesome. Thank you all. Bye.